The ranking member of the full committee, Mr. Scott, is recognized.
Thank you, Mr. Chairman, and I thank the ranking subcommittee chair for yielding. Ms. Matsui, the Trump administration has announced plans to roll back some Biden-era regulations, the payment cap of 7% and enrollment-based, not attendance-based payments. Can you highlight how this new regulation, how the old regulation helped families and how the repeal will hurt families?
Thank you for the question, Ranking Member. The rule that you're describing, as you noted, capped child care co-payments for families at 7% of their income. And as a result, the elimination of this part of the rule really opens the door to families having to pay more and having more of a burden for child care costs than they already face. In addition, the part of the rule which is proposed to being eliminated also got rid of enrollment-based payments for providers. I just want to observe that enrollment-basis payment practices are really how the private child care market operates. When parents enter into contracts with child care providers, providers need a very stable form and predictable form of payment because they're operating on very slim margins. They need to be able to pay rent and mortgage, to make payroll, and having an enrollment-based payment plan allows them to know what their payments are in advance and enables them to keep their doors open. In fact, this provides more options for parents, makes it easier for providers to keep their doors open, and the rule really reflected what the private market already does.
Thank you. Mr. Chairman, I ask unanimous consent that a press release from the National Women's Law Center entitled "Trump Administration Rule Raises Child Care Costs Amid Escalating Attacks on Early Educators and Families" be entered in the record. Thank you. You mentioned the Child Care for Working Families Act. That has investments in workforce and capacity. Can you tell me some examples of those kinds of investments?
Thank you, Ranking Member, and thank you for your leadership in introducing the Child Care for Working Families Act. One very specific aspect of the bill to note is that the bill would make additional investments in pre-K programs and also in Head Start programs to ensure that child care services that are full day, full year are available to more families. And in fact, this would significantly increase child care supply and make sure that parents have options that meet their family's needs, that are available to them, that are affordable for them because of the provisions of the legislation. These are really elements of the solution to ensure that we have a child care system that works for families no matter where they live, no matter who they work for, so that their children are cared for and have their development supported by talented and well-compensated early educators.
Thank you. Now, most people get their health care as a benefit from their employer. What's wrong with relying on employers to provide child care as an employment-based benefit?
Employers who recognize how important child care is for their workers, for a stable workforce, significantly speaks to the benefit of child care and how it helps all of us, helps grow the economy, and really supports work across all sectors. That being said, there are some reasons that we shouldn't be asking everyone to rely on child care through their employers. It's an entirely voluntary benefit, so if employers' needs shift or their costs are unmanageable, they may eliminate the benefit, and that leaves employees in the lurch. At the same time, we may also be locking employees into jobs when they could be looking for other opportunities, and we certainly don't want that as well. Employees may also have different needs for their children. They may want their children to be cared for in different kinds of childcare settings than their employers offer. And in many cases, unlike the witnesses here today, childcare costs are still excessive for workers even when their employers subsidize them. So it's definitely part of the solution, but without robust public investments, it can't solve the full problems in the childcare system.
Thank you, Mr. Chairman. I yield back.